Recording in progress.
Hello, my name is Rowan McFadden. I am a health promotion coordinator here at Healthy Androscoggin, focusing on substance misuse prevention and tobacco prevention. So what I'll be talking about in this video is the importance of harm reduction and the effort of substance use prevention. So let's get started, shall we? So first off, what is harm reduction? And why is it important and why does it work? So the definition of harm reduction is a spectrum of evidence-based strategies to meet people where they're at, but that doesn't leave them there. These strategies really focus on health and dignity, participant-centered services, participant involvement, participant autonomy, with a big focus on understanding of sociocultural factors and an understanding of pragmatism versus realism. Harm reduction efforts really exist across this spectrum, and it also exists across the spectrum of both physical and mental health prevention efforts. When discussing substance use specifically, there are numerous evidence-based interventions that are utilized to help engage individuals in care that they otherwise may not have gotten. So these harm reduction efforts, such as safer use guidelines, syringe exchange programs, and even abstinence, are proven to reduce health and social harm to individuals who use substances. So that being said, when we're talking about harm reduction efforts, we also have to talk about the intersection and the link between harm reduction and stigma. Unfortunately, we can't discuss harm reduction without addressing stigma. Harm reduction efforts in substance use have long been stigmatized. Individuals with substance use disorders face stigma on an everyday basis. But there are many steps that we can take to reduce that stigma that individuals in recovery and individuals in active use face. So first off, what stigma looks like. So stigma really limits a person's ability to access services they need because they feel unworthy of receiving the services or requesting the services even. And the stigma creates barriers while receiving services by people feeling unwelcome or judged by program staff that offers the services. So what impact does this have? The impact of stigma on harm reduction services is pretty significant. Stigma makes it much less likely that someone will seek out services or stay connected to services at all, whether or not they're harm reduction services or other healthcare services. So there is a really significant impact that we have to be aware of when we're discussing harm reduction efforts and how they are linked to stigma and what we can do. So that being said, what are some things we can do? First off, really thinking about the words that we use. The words we use when we're talking about individuals with substance use disorders are incredibly important, not only when we're talking about it, but when we're also talking to someone with a substance use disorder. We further the existing stigmas when we use terms like drug addict, drug abuser, druggie, alcoholic. You know, when referring to someone who's stopped using substances, instead of using the term clean, use the term someone in long-term recovery, person in recovery. It's important to use this person first language because first and foremost, people are human beings. And instead of describing someone as a disease or by their disease, we're acknowledging that this is a person first. And that's why looking at how we talk about these things is so important, because when we're talking about them, amongst ourselves, in our families, in our communities, it has a larger impact. There is a ripple effect. And that's why we have to be mindful and choose our words with care. So that being said, what resources exist in our community? We actually have some really great harm reduction efforts and harm reduction services here in Androscoggin County, and particularly in the Lewiston-Auburn area. So across Androscoggin County, we have community safe disposal boxes for prescription medications. So they look like these here down on the right-hand side of the screen. They're around year-round. You can find them at pharmacies. You can find them at supermarkets, town halls, police offices. They're a great resource for unwanted or unneeded medications. Also, Healthy Androscoggin has on hand disposal kits as well. So if anyone in the community can't for some reason access these disposal drops, they can always contact us and we can get them the resources that they need. Additionally, in Lewiston, there are 11 safe syringe disposal boxes throughout the city. And this ad here on the left-hand side of the screen with the QR code can show you a map of all of the existing drop locations. And these are completely anonymous. Nobody knows who uses them. You can just drop off used syringes. So in addition to these syringe disposal boxes, there are 2 syringe exchange programs in the greater Lewiston Auburn area. The first is the Church of Safe Injection at $195 Wingram that is run through the Tri-County Mental Health Services. And a quick Google can get you connected to both of those resources. Also, some additional really amazing harm reduction resources that we have in our community are nalox boxes. So what these are metal housings outside of buildings that have an alarm when you open them. And they also inside have naloxone, which is a medication used to rapidly respond to potential opioid overdoses. So as soon as you open that housing, as soon as you get that naloxone out, the authorities are called so someone can respond to the scene, particularly healthcare, to help the individual who is potentially experiencing an opioid overdose. So with that being said, there's also numerous online resources around harm reduction that go more national versus local, but they are amazing. Also some statewide efforts as well, such as Get Maine Naloxone, which is a website that anyone can access to find different access points for naloxone. Also, Emergent Biosolutions Naloxone Program. This is an amazing program for YMCAs and libraries. It provides free naloxone to any of those libraries or YMCAs across the nation. Also, if individuals are interested in implementing a policy around naloxone for the workplace, because we never know who's going to walk through our doors, and having naloxone on hand could save lives, and oftentimes does. So there is the Naloxone in the Workplace Toolkit that is another amazing resource that can be found with a quick Google to help people understand, okay, how do I build a policy around naloxone in my workplace? Where am I going to have it available? And what can that look like? What will that look like? And finally, with all of these efforts, what can we do? What can we do to help spread awareness? What can we do to help reduce stigma? And what can we do to help people access harm reduction services? So first off, know the facts. Continue to educate yourselves because this information is ever changing. The services that are available are ever changing. And knowing the facts is one of the best ways that you can prepare yourself. Also, be really aware of your own attitudes and behaviors because we don't know what we don't know. And if we don't take steps to kind of look at our own beliefs and values, how can we ask other people to do that? And also, as we discussed, choosing your words carefully, thinking about what we're saying. And also, with the knowledge that we've gathered for ourselves, sharing it with others, because that's a great opportunity to get the word about these resources out there, to connect people who may not be connected. Also focusing on the positive, because a lot of these efforts save lives. They provide connection, they provide stepping stones. They're there for a reason. They're proven to work. And then we continue to support people. And in doing that, we include everyone in that support. If anyone has any questions, needs additional information on harm reduction resources, is interested in any trainings, please feel free to contact me at the email below or give us a call at the office and we can help you however we can.